Senator Sanders' plan, his plan is even more comprehensive than the Canadian plan because he wants to add free dental, free drugs, free long-term care, free hearing. They don't even have that under the Canadian healthcare system. And Charles Blayhouse at Mercatus has costed out his plan from 2017 at $32 trillion over 10 years. No government program, Mark, ever turns out to cost what it's predicted. Remember Lyndon Johnson, the Medicare and Medicaid under the Great Society? It came in at $3 billion in the first year of Medicare. They predicted by 1990 it would cost about $12 billion. It cost $110 billion. So even at $32 trillion or $3.2 trillion a year, currently we're spending about $3.5 trillion a year on healthcare. There is going to be a huge demand and the cost will be much higher, and government's going to have to cut back and control. We'll get waiting lists, care will be rationed, taxes will have to be increased, and of course that doctor shortage issue as well.
You were born in Canada. What happened to your mother in Canada?
So my mother was a senior, and she felt that she might have colon cancer. And so now Bernie Sanders says in his plan no person will have to get a referral to go to a specialist. But in systems like Canada and the UK, you have to. That's how you help control costs. So she went to her general practitioner and said she thought she had colon cancer. He said, well, we'll do an X-ray. And so nothing showed up, of course, in the X-ray. And I said, Mom, you don't detect colon cancer with an X-ray, you need a colonoscopy. So she wanted me to call back, but I got her to call back. And he said, well, you know, as a senior, we have too many younger people on the waiting list to get colonoscopies. Some people are waiting 8 months to a year. And so she didn't get her colonoscopy. 6 months later, she was hemorrhaging, and she went to the hospital in an ambulance, 2 days in the emergency room, 2 days in the transit lounge waiting to get a bed in a ward. She got her colonoscopy, but she passed away 2 weeks later from metastasized colon cancer. That is rationing of care, and you reduce cost by denying care to people, but it's very, very sad. And the same thing will happen, you know, in the United States. Look at the number of people in the VA who complain about the VA, the long waiting times. Vets are being dying on gurneys waiting for care. There's fraud. The VA is a single payer system in this country, and people have to realize that's an example on a micro level of what would happen if the government totally took over our healthcare system.
Horrible what happened to your mother. And you said something in there, she was a senior.
Right.
She wasn't prioritized.
No, absolutely not.
If you're younger, you will be prioritized under certain circumstances. And so now we have the government making decisions about life and death, not individual human beings making decisions about their own lives. Sorry, you can't get a colonoscopy. Why not? Well, only the government provides them and approves them. Okay, I need one. Okay, but you're elderly. Well, so what? Well, we have younger people who are waiting, so you have to wait. Either you leave the country to get care somewhere else, or you're stuck. Correct?
Yes, absolutely. And today in Canada, about 200,000 Canadians out of a population, Canada's a very large country, but with about 37 million people, 200,000 Canadians go abroad every year to pay out of pocket for an MRI machine, MRI, a stent, a new hip, a new shoulder, because the waiting time is just too long, because the government sets that budget 11% in Canada of gross domestic product, and that's what they're prepared to spend. So you have to get waiting lists when, as I say, that demand is much greater than what the government is willing to supply.
There's really so much I want to discuss with you. Let's talk about this gross domestic product. You know, people are great, who cares? 11% in Canada. So they arbitrarily decide, the government does, that's the amount of money we're going to spend, 11%, equivalent of 11% of the GDP on health care. In the United States, it's what percent?
Just over 18% today.
Just over 18%, and I hear Bernie Sanders and others say, we spend too much on health care. And first of all, I think to myself, as opposed to what?
Right.
As opposed to what? A cake or cars or whatever. You spend what you need to spend. But here's my question to you. When you say health care, that's a big industry. It's technology, it's buildings, it's personnel, it is everything associated with it. So it's a very, very important part of our economy, right?
Right, exactly.
So the idea is that we spend 18%, we have to spend less. You spend what you spend. And one of the pressures on the increased spending, quote unquote, on healthcare, isn't it government?
Well, exactly. 50% of healthcare in this country is in the hands of government already. People say, well, America has this free market healthcare system and people are dying in the streets. Well, that's just not true. 50% is in Medicare, the program for our seniors, Medicaid, the program for low-income people, the VA, the Veterans Administration, and the CHIP program. We have a lot of government in our healthcare system, and government, whether it's at the national level or at the state level, has a tremendous number of mandates on insurance companies and what they have to provide, which adds tremendously to the cost. But you know, if you look at 18%, my mom used to say, well, you know, I hope you're not becoming one of those impatient Americans. America is the most wealthy country in the world. Americans, if they want an MRI, they think they have a brain tumor, they want it tomorrow or next week. They don't want to have to wait like Canadians 11 weeks on average to get an MRI, and that's why so many leave the country and to get something that's
And
important.
they're counting on it. They're counting on a certain, I bet the green eye shade types in the bureaucracy in Canada are counting on a certain percentage of the population getting health care somewhere else.
Yes, exactly. And it's interesting, being from Vancouver, one of my friends, Dr. Brian Day, an orthopedic surgeon, runs a private clinic called the Camby Surgery Center. And of course, it's illegal to have private coverage. The provinces, the provincial governments actually run each healthcare system. The feds provide funding, and then the provincial governments raise taxes. Brian has been in a lawsuit, being sued by the BC government in the BC Supreme Court for 3 years because the government says what he is doing is illegal. He's treating 60,000 patients a year, and some of them are even politicians who don't want any private coverage, but they're using the system when they think, his program, when they think something is serious. So here he is, they're trying to starve him of funding to support this case. But you know, if he treats 60,000 people and they're paying for it, the BC medical plan will pay part, but it's taking pressure off the government system where people are having to wait.
When we